Hi, good morning. This is Mahekdeep Kaur. My student ID is 11982522, and I am here for wound dressing procedure. Before that, we'll do a 360 rotation of the camera. Before moving to the patient, I'll do the hand hygiene. So, hi, good morning. This is Mahekdeep Kaur. I'm your nurse today, and I'm here for wound dressing procedure as I have my physician's order. Is that fine with you?
Yes.
Okay. So, may I know your full name and your date of birth?
Chobanpreet Kaur, 27/8/2000.
Can I see your wristband? Okay, perfect. It matches with my record. May I know if you have any kind of pain?
No.
No, like from if 0 is no pain to 10 is the maximum pain on that scale. So you would rate pain as
0.
0. So the patient has no pain means the rating scale, on the rating scale, the level of the pain is 0. So we'll ask about allergies. Do you have any kind of allergy to drug or anything like that?
No.
No. My patient doesn't have any allergy to drug or the food substance. So we'll move forward to elevating the bed to my height and repositioning the client. Like, could you please come towards me? Yeah, that's enough. That's fine. Okay. So about repositioning, if the wound is on the chest, abdomen, or the back area, we need to reposition the client. But since the wound is on the forearm, we need not to reposition. Just like come closer to me, and that's fine. So after that, we'll do the hand hygiene and provide the privacy to the client. So after hand hygiene, we are going to open the tray. Firstly, away from me, opening the sides, then towards me. So going to reposition the tray from diamond to square shape and maintaining this 1-inch border. And this is a kind of sterile triangle where this is a dressing area, this is the garbage bin, and this is my patient. We are maintaining the sterile triangle. We are adding the splice, firstly pouring the solution at certain height, then adding the splice, the gauge piece, by banana peel method, discarding it off, and then adding Q-tip again by banana peel method and discarding it off. So firstly we'll go with assessing the wound. Before that, we need to hand hygiene and put on the gloves. So we'll assess the previous dressing. So on the previous dressing, we can see that there's no active bleeding or any pus, but there is a small amount of serosanguinous fluid. We'll discard it off in the garbage bin. So we'll assess the wound now. So the region or the location of the wound is on the forearm on the right side, and we'll check the length of the wound with Q-tip. Measuring on a measuring tape. So discarding it off. The length of the wound is 5 centimeter, and it is well approximated and close to each other and closed by the sutures. So we'll palpate it. Do you feel any kind of pain?
No.
The patient doesn't feel any kind of pain on palpating, and there is small amount of erythema and no presence of pus or edema. So we'll discard the gloves. Do the hand hygiene, put on the new gloves. Now we are moving forward to cleaning the wound. So we'll be making the dumplings. we'll soak it in a solution and remove the excess of the solution, and we are going to clean it from the head position to the feet position, head to toe, and away in a location away from me, that is farthest to me, in a single stroke, and discard it off. Same we are going to make dumplings. Remove the excess. So area closest to me, discarding it off, making another dumpling, soaking in solution, removing the excess, so along the midline, and discarding it off. So the wound has been clean. Now we'll pat it dry by making another dumplings in the same order as we have already done. So we'll pat it dry from head to toe to the farthest position. Patting dry to the area closest to me, discarding it off. Making another dumpling for patting the area along the midline and discarding it off. So what we'll do is, after cleaning and patting it dry, we are going to skewer the wound by a gauze piece. Since there is no bleeding, like, we can add the pads, but there's no need of that, but like, I'm adding another gauze piece over it. So with the help of taping, I'm going to skewer it. I'm going to skewer the new dressing by taping along the borders. So on this tape, I am writing down my initials as I have performed this wound dressing procedure, and I'll write out the today's date and the time when the procedure is performed. After this, we'll check to the patient, like, do you have any kind of pain?
No.
Are you comfortable?
Yes.
So my patient is well tolerated, does not feel any pain. She is comfortable. So we need to reposition the client. Like, you can move to the farthest area. Okay. So again, as told earlier, that we need to reposition the client, and after repositioning, what we'll do is we'll adjust the height of the bed to the lower position, and this is your call bell. You can call me whenever you feel the need of it. So after this, I'm going to again do the hand hygiene, and I'm going to document the procedure with all the details of the assessment and the finding of the wound, that I have performed this wound dressing procedure at this time, and signing it off. So after this, this is the end of the procedure, and we are going to do 360 rotation of the room. Thank you so much.